Congratulations! You are now a full-fledged master of active isolated stretch for the semitendinosus muscle. This is the last lessons which completes the stretch techniques on how to precisely target that middle muscle of your hamstring. If you missed the other lessons, just watch it again. Anyway, you have to be better than good. Consistency and repetition is the key. Our lesson for today is the most common stretch that you see in a gym being done by a personal trainer, or probably your most requested stretch to your trainer after a workout. As you expected in our case, the level of pain should not make you tap the floor to show a sign of mercy like in wrestling competition. You know for a fact when that happened, muscle will just fight you or resist your stretch. As a result, your stretch goal will not be productive. So for this stretch, the motion will occur in the hip joint only, with the knee joint stable and extended, meaning the knees should be straight as much as the subject can tolerate. Since this is the most common stretch, this is also the least likely to be tight or short in a more flexible subject. We are comparing this among the three major muscles of the hamstring. The semitendinosus muscle is the least likely to be limited in range of motion compared to the two other hamstring muscles, namely the biceps femoris, or the outer part of the hamstring muscle, and the semimembranosus muscle, which is the inner side of the hamstring muscle. Why am I emphasizing this? There's two reasons. Number one, if you only stretch the middle muscle or the semitendinosus muscle, it will not work, especially if your goal is an overall improvement of range of motion. Number two reason, most shortening or limited range of motion is not happening or not coming from this specific muscle, which is the semitendinosus muscle. The significance of stretching this muscle primarily is to serve as a functional mobility assessment, since this is the most commonly used in movement. So much for that. Before starting to stretch your subject, there is a guidelines for the subject to know that is recommended. The following pertains to the amount of stretch pressure or intensity, which usually depends on the individual preference and sensitivity. But this could be used as a guide for both the stretch therapist and the subject to be stretched. You can use this to educate and communicate better during the stretch session. So listen carefully. Here we go. Number one, tell them that the applied pressure should be described as a slight irritation coming from the stretch. Number two, the subject should know that it should be tolerable but challenging. And number three, it is not a no pain, no gain approach. Or they can describe it as a good pain or just hurt so good feeling. This is another reason why it is also important for you as a stretch therapist to know how to do your self-stretch using this method. A review of one of my videos on how to stretch the right way is not only crucial but will give you an advantage to learn faster and further immerse in this scientific approach to free your body. For further information about the effectiveness of AIS method based on the latest year 2019 study, the two most accepted technique that effectively promotes better joint motion is the gradual progressive repetition of the stretch pressure and with the concomitant breathing out or exhalation during the stretch phase. The repetitive progression of stretch helps in breaking down adhesions and long-time byproduct accumulation in the joint like an injury, consequently regaining back the natural joint mobility to its ideal freedom. Exhalation reinforces relaxation of the muscle to slowly accommodate each applied stretch pressure and eventually reach your intended range of motion without the resistance of the muscle. So make sure your subject is not holding their breath during the stretch session. In case they are confused about breathing in or breathing out timing, then your last resort would be to ask them just to breathe normally and as comfortable as they can. but never ever hold the breath. Another study at its inception is the accuracy of the active isolated technique on hitting areas which we call the line of stress. The line of stress has a lot to do with your hand placement and strap belt for stabilization. This too contributes to the accuracy of your target area of isolation. And the more accurate your isolated technique, the closer you get to the line of stress, which lowers the tissue resistance that you will encounter. If you want more scientific details of this study, leave a comment below and type YES, yes, so I can send you a free PDF copy from the latest Journal of Exercise Physiology. But how about the less than 2-second stretch hold issue? If you are following my YouTube channel, your stretch method here is mostly confined to less than 2-second stretch hold. My own theory on this is beside that it serves as one of the feature and characteristic of AIS which makes it different from dynamic stretch, which has no pause to stretch, is that less than 2-second stretch hold act as to desensitize your sense of stretch moment irritation, thereby calibrating your nervous system. Neuromuscular system then accommodates and get used to it. Your body eventually and gradually adapts until you reach and regain your own personal ideal range of motion. Static or holding it longer than 3 seconds is too much for your healthy nervous system to tolerate and can be considered sometimes aggressive. Progressive repetition is better to mechanically break down those adhesion between layers or sheets of fascia than just holding the stretch longer. So in all your approach, for now, stick to the having a pause or very short moment of stretch pressure and focus on 4 repetitions to as much as 12 repetitions. On this lesson, you can start training your subject to participate using simple verbal cues. You can say, "Help me move your straight leg up." Since you don't want to create sudden stretch irritation, by using just one hand together with his participation, you reduce your force and keep your stretch progressive pressure under control. Also, for this 80-year-old male subject, one hand with light grip of your hand will lower his muscle guarding and any unexpected stretch irritation that he might not be accepting in the beginning. Your stretch repetition and gradual progressive stretch pressure will be accommodated by a noticeable increase in range of motion as you repeat your stretch. Take note of the amount of range of motion that he can reach for every repetition that you ask him to move and participate. With that in mind, you know exactly how far he can go without you overstretching the hamstring. A paused or stretch hold is one of the key to release any limited range of motion. The more pressure you applied, the more important to pause and stretch for at least less than 2 seconds. In this case, left hamstring has a very slight tightness compared to the right side, which you can consider insignificant, which means not to bother since it is too small of a difference. This is shown by his slight bended left knee while being stretched. Did you notice the difference on how you handle the right compared to the left side of the leg? I don't usually do this, but I can include this as a bonus for you. Let's repeat the video in slow-mo. With the right leg, you only use one hand throughout the stretch set. But as you transfer to the left leg, your assessment shows that he has difficulty straightening or extending his knee joint compared to the other leg. As you continue, you started using your other hand to stabilize the knee joint. This is an important demonstration on advanced stretch technique application, taking careful consideration of the difference in range of motion should always be included in your initial assessment, thereby avoiding aggravation of already present imbalances of the body. Beside your goal to balance and have both hamstring length as equal as possible, your secondary goal is for both hamstring to reach at least 90 degrees of comfortable range of motion. Ideally, 110 to 120 degrees, the maximum functional range. In my experience, beside that we are evolving with our technological society, most experienced runners that I encounter since 2008, no issues whatsoever with having exactly 90 degrees minimum of range of motion. Remember that the ideal range of motion objective falls to your secondary goal. A balance or almost close to the same range of motion of both hamstring will always be your priority. This is the same range of motion rule with your other muscle. Just to let you know, there are 5 ways to fully free up and lengthen your hamstring muscles compared to static stretch, which only has around 2 or 3 ways. If you're interested to everything I'm talking about right now, leave a comment below and tell me more about yourself and your joint mobility goal that you think requires this type of stretch method. Then smash that subscribe button so you don't miss any content, and make sure you ring the bell icon below.
Thank you for listening. This is Jace Lee. I am an active, isolated stretch practitioner.